So we have a 14-year-old CP patient, and as you can see here, she's got severe dislocation, talotarsal dislocation. She also has zigzagging, whereby the talus is going in, midfoot is going out, and then the forefoot is going in. And you can see with the hallux varus how bad this is looking for her. And she has also elevated first metatarsal, severely elevated, because she has no peroneus function whatsoever. Posterior tibial is not functioning either. She has OTE, and she's rigid, very rigid. Could be coalition, tarsal coalition as well. We did x-rays. We're going to show you the x-rays in a minute, but this is happening on both sides of the feet as well, and you can see that on both sides. There's very rigidity, and the muscle mass in the legs is too small. And what we're going to do is we're going to have her stand up, push this one. So we're now on the floor, and you can see the zigzagging of the foot. So it's going in on the talus, going out in the midfoot, and then coming back in the forefoot and the toes. You can see how the toes are crunching and grabbing on the floor. Posterior tibial is not functioning, peroneus longus is not functioning. Only thing is the anterior tibial, and she has very tight tender Achilles. All of this, and she has very tight and flexor contracture because of the CP that she has. And it's the same on the other side. Now if I try to hold her and move her, she can't move. So this is a rigid foot. And this is not going to be a hyperacute case. We need to undo the rigidity first before we do anything else, and see how that works out, and then go from there. But this is a case, and you can see how this is going up. So there's almost like a rocker bottom foot on here and on here, whereby the foot has no arch. It's a reverse arch, and there is no transverse arch. Also, there is a reverse arch on the transverse area. So there's a reverse arches here and here at the same time, and that's bad configuration when she walks. So we're going to have her stand all the way back there and try and walk for us, and we're going to take some pictures. So it's, all right, yeah, just keep coming. Atachi. Keep going, come on. More. You can see she walks sideways because she has no balance, and she's almost going to fall here because of the configuration of the foot. Just keep going, one more time. And one more time, come back to me. Okay, she's very unbalanced. All right, thank you, young lady. And what we're doing here is you can see how this is turning down. There's a ledge right here, an elevation of the first metatarsal, and the toe is coming down, so there's a flexor contracture. You can see almost the edge of the navicular versus the cuboid area is very close. No sinus tarsi whatsoever. There could be coalition between talus and calcaneus right in this area. The same thing on this side, and the same thing with the elevation of the first metatarsal. Severely elevated on both sides. You may want to consider a cotton. I don't know if the cotton is going to be enough. We may need to do cotton plus a application, plus hypercure, plus removal the coalition if there's coalition. But she still is growing, and we have to think about all this as we're doing all this stuff. So first step here is to get a CT of the whole foot to see what we're dealing with before we move on to the next step. And we'll just keep you going. We'll just keep you informed as time goes on as to what this lady's going to have done, and we'll show it to you later.